Good morning to everyone. My name is Huang Wei Ling. I'm a medical doctor from Brazil. I'm very happy to be here in this conference and also to congratulate all the presenters and all the organizers of this conference. The title of my presentation is Myocardial Infarction without Arterial Obstruction in Patients Post-COVID-19 Treatment. This presentation will be following Hippocrates' thoughts that said that it's important to consider other ancient medical traditions prior to the knowledge we have nowadays. For this reason, I will use the reasoning used by traditional Chinese medicine in the energy point of view to explain this subject. Cardiovascular disease is the leading cause of death worldwide, accounting for 17 million deaths in 2017. And more than 155 million people worldwide have confirmed SARS-CoV-2 infection, and more than 3 million have died of this disease. And 150 or 1/3 of hospitalized patients will have evidence of myocardial injury, defined as the presence of elevated cardiac troponin levels at the time of admission. As said by Hippocrates, we need to look for the oldest medicine prior to the knowledge we have nowadays. For this reason, I will show you the different viewpoints between Western and traditional Chinese medicine to you to understand how is the mechanism of myocardial infarction without arterial obstruction in patients with or without COVID-19. This patient, in this study, I will show you one case of a patient that had COVID-19 and developed myocardial infarction 2 weeks after the treatment. In this tree, I'm showing the metaphor of how is the point of view of Western and traditional Chinese medicine. This tree has a trunk with several branches and it's divided into parts, the part above the earth and the part under the earth. The part above the earth corresponds to the trunk with several branches, and each branch means one medical specialty. And for example, in cardiology, branch, you can see many leaves, and each leaf corresponds of one symptom or disease treated by cardiology specialty. For example, you can have a leaf of hypertension, you can have a leaf of arrhythmia, of myocardial infarction, etc. And there is a branch of infectious disease, for example. An infectious disease, you have a branch of pneumonia, meningitis, tuberculosis, AIDS, or in this case, you can have a leaf of COVID-19. But what TCM understands is that all symptoms in all kinds of specialties is not on the leaf. The problem in TCM, the problem of all kinds of disease is on the root of this tree. And this is the aim of my presentation today, to show which are the energy alterations in this root that are leading to myocardial infarction without arterial obstruction in patients with COVID-19. And also TCM considered the symptoms, but to treat the real cause that are in the root of this tree. And these roots are usually invisible by the naked eye because it's composed by energy. And two theories in TCM, that is yin and yang theory and the 5-element theory, that they are usually invisible by the naked eye. And Western medicine do not consider this part as scientific because they only consider scientific what they can see or prove by radiological or by laboratory alterations. And what all the alterations in the energy level, Western medicine considered that's not unscientific, but this alteration is happening in all kinds of patients, in all kinds of disease, and that's why we need to understand these alterations to understand how is the formation of disease in the energy point of view. And also traditional Chinese medicine understand that all the influence of the external pathogenic factor can lead to initiation or formation of disease, such as the influence of cold, wind, heat, humidity, and dryness. And these factors, they can begin some infectious process, such as the manifestation of some many kinds of infections, such as hospital and community infection. They can begin by the exposition of cold and wind that we have very common nowadays in the hospital environment, that they are very cold nowadays because they understand that cold can reduce the bacterial infection, but they do not understand that the cold can influence the formation of disease in the energy point of view. And the first theory is the yin and yang in the root of this tree. Yin and yang are two energies that is opposite, but they are complementary, such as this is yang and this is yin, such as man and woman, day and night, sun and moon, cold and hot, and every opposite, they are complementary, and this exists in our universe. And yin and yang are produced by the kidney in our body, but to yin and yang to flow inside the body, there is the necessity of having blood and qi. And blood is an energy produced by the spleen in TCM, and qi is an energy produced by the liver and the lung. And as you can see, there is a necessity of having this equilibrium between these four energies inside the body. And when there is a deficiency of yin or yang or qi or blood or a combination of these four energies deficiencies, there is a possibility of stagnation of this blood inside the blood vessel, leading, in this case, to our arterial obstruction. And I will show you which are the organs that are producing these energies, and which is the situation of these organs nowadays in an individual prior to COVID-19 and after COVID-19, what will happen. And this is these four forces that I am showing, that when there is a deficiency of one energy or a deficiency of combination of energy deficiencies between these four energies, there is a formation of internal fire inside the body that can be manifest clinically in the leaf level as anxiety, as panic syndrome, as insomnia, as all kinds of infections, has in the root of this tree this formation of energy deficiencies and formation of internal fire. And patients with diabetes also have this indeficiency and formation of internal fire. And that's why I have some articles showing that I can treat all kinds, the majority of infections, community and hospital infection, only taking out this heat, because this heat is the alteration that all patients that has yellow secretion or red manifestation in the skin, for example. This is a formation of internal fire inside the body, that if we reduce this fire inside the body, we can reduce all kinds of infection and treat this energy imbalances condition, replenishing and rebalancing this energy to normalize their function. And the second theory in the root of this tree is the 5-element theory. The 5 elements corresponds to water, wood, fire, earth, and metal. And inside the body, they have a representation of the 5 internal massive organs that corresponds to kidney, liver, heart, spleen, and lung. Very different from Western perspective in Chinese medicine. They understand that each organ works in Chinese medicine, they understand that each organ is sending energy to the following organ, and very different from Western perspective that they say that each organ works independently and separately. And for example, heart, in Western medicine, they usually, the problem in the heart, they usually treat the heart, but the heart can is receiving energy from the liver and can receive influence from the kidney or receive the influence from the spleen. And that is why the manifestation in the heart could be the disease in other elements and not in the heart. For example, patients that are having kidney insufficiency, the problem could be not in the kidney, but the problem could be in the spleen or in the liver. And patients with COVID-19 that's having problem in the dyspnea, for example, could be having this symptom due to energy deficiency in the kidney that is leading to a blockade in the transmission of the lung from the kidney. And in the traditional Chinese medicine, they understand that all symptoms in the organs could be related to the disease in other organs, leading to disease in the affected organ. And what I want to say is there is a chakras energy centers that is studied by Ayurvedic medicine, but there are some studies correlating the chakras with the 5 elements in traditional Chinese medicine. The first is the liver and the second is the spiritual chakra. And the first chakra corresponds to liver, the second corresponds to kidney, the third corresponds to heart, the fourth corresponds to lung, and fifth corresponds to spleen. And this is the membrane concentration controlled by the kidney, and the spiritual chakra is responsible for the liver. And each organ in TCM, they are producing that energy and to keep this organ, the blood circulating inside the blood vessel. And when there is a problem in this organ and deficiency in this energy that's producing these energies, that there could be the formation, the blood stagnation could be a result of these energy deficiencies, as I showed you previously. And in this study, I measured the energy of these organs using the radiesthesia procedure, using a crystal pendulum that I put in front of each chakra to see the movement of this crystal. And in China, they usually use the measuring of the pulse of in the wrists to see the energy of each organ, but this is not so good to do in our practice because each doctor has it's very different to you compare in a scientific study. And the Zen Qi is an energy that we have in our body that is protecting our body to the invasion of these external factors, in this case, COVID-19. And when our protection is normal, and the Xie Qi is the virus, for example, is lower, the patient will not have the disease. But the majority of patients that I am tending in Brazil, and it's happening in the whole world, the Zen Qi is very reduced, our protection, the energy that protects our against the invasion of the external factors. In this case, the SARS-CoV-2 is lower than the Xie Qi, and the Xie Qi is the virus. The patient could develop the disease, and if the Zen Qi is lower, it will have more gravity of this patient. In this article, I'm saying that the patients that are having myocardial infarction, when you measure the energy of all these patients, they will have alterations in all the internal massive organs that I show you. They will have alteration in all these chakras energy centers. And 80% will have this energy, but the majority of my patients nowadays do not have energy in the liver, in the kidney, in the heart, in the lung, and the spleen, and denotating that the production of this energy is very low in the majority of patients nowadays. And this is not happening only in Brazil, but it's happening in the whole globe. because this reduction of energy is caused by the chronic exposition of electromagnetic radiation, leading to a state of immune deficiency nowadays, because our energy is our immune system. And when our energy is low, our immune system is very compromised, leading to a state of immune deficiency. And this is another article that I published saying that the chakras energy deficiency is the main cause of myocardial infarction without arterial obstruction. In this case, I'm saying that the patients that are having myocardial infarction without arterial obstruction, they are not having energy in all these organs that is not producing this blood and yin and yang and qi. And that is why the blood will stagnate in the blood vessel and leading to, in this case, myocardial infarction. And this is another study that I wrote in 2021, analyzing 1,000 patients in my clinic from 2015 to 2020, showing that the majority of patients, including babies, children, adolescents, young adults, and older patients, they are in the lowest level of energy in all these inside the 5 internal massive organs. 1 is the liver, 2 is the kidney, 3 is the heart, 4 is the lung, and 5 is the spleen. This is the memory and concentration in spiritual chakra. And 80% of my patients they have the spiritual chakra, and 20% they do not have the spiritual chakra. And as you can see, the majority of my patients, independent on the diagnosis and independent on the age group, independent on the diagnosis, they are having the same result in the 5 internal massive organs. And this is very different from when we measure the energy of this organ in the past. And they usually have energy, and suddenly this is the result after 2015. And this is caused by the influence of this electromagnetic radiation in a chronic exposition due to the use of cell phones and computers, and the exposition to Wi-Fi, and leading to this immune deficiency state. And this is another article that I wrote. Are we vaccinating immunocompetent or immunocompromised people for COVID-19? I'm saying that due to this energy deficiency situation result that I found in my research, I'm saying that the majority of patients nowadays are considered immunocompromised and not immunocompetent. This is including us nowadays. We are very energy deficient, and we needed to treat this energy deficiency situation to do not have any other disease such as myocardial infarction, patients with strokes, diabetes, hypertension, patients with autoimmune disease or cancer, all have in common this energy deficiency situation nowadays. And patients that are having COVID-19 with anosmia and loss of taste, this is due to this energy deficiency in the lung and in the spleen. And here is another article that I wrote. This energy deficiency is the cause of dyspnea post-COVID, and nowadays Western medicine is treating the COVID-19 infection with high concentrated medication. And in this type of new type of population that we are treating nowadays, if we use the high concentrated medication, this energy will reduce even more. I will show you a law that is saying this. And this another article is the population in the world, the same as in the past. I'm saying that the population is changing the energy pattern. The population is not the same, because in the past they have energy inside the 5 internal massive organs, and nowadays all the patients, including and in any age group, they do not have energy, and the population is not the same. And that is why we need to change the type of medication that we are using to treat them, because depending on the type, if they are high concentrated, we will induce complication. In this case, we will induce myocardial infarction. And this is the law that I showed to you, is Arne Schultz law, created in 1888 by two German researchers. And in this research, they are saying that the use of any kind of high concentrated medication will reduce the vital energy. And that is why in this new type of population that we are having nowadays, considered very low in energy, we need to use high diluted medication. And here's another article to say that patients with anxiety also have energy deficiency inside the 5 internal massive organs. And that's why the use of high concentrated medication will not improve the anxiety, because it will reduce the energy and will worsen these symptoms. And in this presentation, I will show you one case report. Is a 42-year-old male patient that he had COVID in January 2nd last year. And after he had first symptoms of mild cold, runny nose, and after 5 days, he tested positive for COVID-19. And in the hospital, they prescribed ivermectin and vitamin D. He could only lie down and all day. And after 10 days of the first symptoms, he had the worsening of his condition. Because he used a high concentrated medication, he went to the hospital and started taking too much drugs, and they prescribed to him hydroxychloroquine and another corticosteroids. And after 15 days after the symptom, he was discharged from the hospital, but 16 days after the infection, he went back to work. But at the lunch, he returned home as he was unable to work, very tired and weak. He was not even able to climb or fly a stair normally. And 17 days after the infection, as soon as he woke up, he felt a pain in his chest. He was salivating and his heartbeat was around 40. He went to the hospital emergency quickly, where through the electrocardiogram, no changes were detected. However, in the troponin exam, there was an alteration. When the exams were repeated after 2 hours, this alteration has increased from 334 to 824, 1 hour after this first measurement. Where the reference value is less than 53. And 20 days after the first symptoms, he did the catheterization, and they saw that no coronary arteries had no obstructive lesions, and anterior descendant artery with slow flow, and left ventricle with normal contractility. And this is his electrocardiogram. And during the hospitalization, he took anticoagulants, coronary vasodilators, and antiplatelet agents. And after 3 days of hospitalization, he was discharged. And after 23 days of the first symptoms, he had herpes zoster. I will show you why he developed this herpes zoster. And he went to the hospital again, and they prescribed acyclovir and this medication, but he's still having a lot of pain. And he was taking all these medications, enalapril, Concor, and all these medications. And after all this is normally his heartbeat is 17, but all these events, it is more tachycardia. And he went to my clinic to treat his herpes zoster pain. And I measure his energy, and all his internal organs energy were in the lowest level of energy, only have energy in the spiritual chakra. This means that the spleen that is producing the blood is not having energy. Kidney for the formation of yin and yang is very empty of energy. And liver lung that's producing chi is also very empty of energy. And heart energy is important to circulate the blood inside the blood vessels. The first step in all this treatment was to change his dietary aspect, to begin to balance these energies, avoiding the ingestion of all dairy products, avoid the cold water and raw food and sweets, because all this food can reduce the spleen and pancreas energy, that's the fifth chakra. And also to avoid the ingestion of fried food, egg, honey, coconut, alcoholic beverages, and melted cheese, because all these food can reduce the liver energy that is important to production of qi, and also to avoid the ingestion of soda, coffee, and mate tea, because all these drinks can reduce the kidney energy important to production of yin and yang. And in the second step, I did the apex bloodletting. Is a procedure very important in TCM to release the heat that the patient with energy deficiency is producing, an internal heat that I show you in firstly. And doing this treatment, the patient can reduce the pain in the herpes. And to tone the energy of each organ, I use high diluted medication. As I show you, we need to use high diluted medication instead of high concentrated medication. According to Arnschutz law, to treat liver, I use phosphorus; to treat kidney, natrium muriaticum; to treat heart, sulfur; to treat lung, silicia; spleen, calcárea carbonica. And this medication the patient needed to use for entire life to replenish the energy of these chakras. And the result of this treatment is that after this treatment, he improved his herpes zoster, because herpes zoster in traditional Chinese medicine comes from this formation of internal fire caused by this energy deficiency inside the 5 internal mass organs. And he never had another myocardial infarction, because we replenish the energy of the yin yang qi and blood produced by the spleen, kidney, heart, liver, and lung, that are important to keep this blood circulating inside the blood vessels. This is another article that I showed how to treat recurrent herpes zoster without using antiviral drugs. Because if we use antiviral drugs that is considered high concentrated medication, it will reduce even more our vital energy, inducing more formation of fire and increasing the symptoms of herpes. And here, this is another article that patients that need to receive pacemaker indication have in the background these energy deficiencies inside these 5 internal mass organs. That is the cause of the low heartbeat. And that's why when we treat this condition, replenishing these organs energy, the patient will not have indication anymore of a pacemaker, because the lack of energy inside the 5 internal mass organs is the cause of the reduced heartbeat. Only to say that homeopathy and acupuncture are considered medical specialties in my country, Brazil, since 1980 and 1995 by the Federal Medical Council. I'm showing that they are 2 tools very important to treat the majority of disease nowadays, because we need to do not use so many high concentrated medication due to this energy deficiency situation that the majority of population are having nowadays. For this reason, they are 2 important specialties that we need to how can I say, I know that there are many countries in the world that do not consider them as medical specialties, but they are very important to be used in this new type of population that we are having nowadays. And to understand how is the mechanism of myocardial infarction in patients post-COVID-19 treatment, we needed to integrate Western and traditional Chinese medicine to understand the symptom in the leaf level and the energy alterations in the root. And the conclusion of this study is that patient, when treated with high concentrated medication to treat SARS-CoV-2 infection, can develop blood stagnation. In this case, the patient developed myocardial infarction and developed the herpes zoster without arterial obstruction, because what caused the myocardial infarction was the energy deficiency situation, and this myocardial infarction was in the energy level and not to have any arterial restriction. Caused by the use of high concentrated medication to treat, in this case, COVID-19 infection. And this is the article that I wrote. You can search online. And according to Hippocrates, healing is a matter of time, but sometimes it's also a matter of opportunity. Thank you for your attention. This is my email address. If you want to ask something or connect with me, I will be very happy to answer you. Thank you.